Welcome back, everyone. We're to the supply chain workshop part. It's good to see that in one hand, that the room isn't as full as we were anticipating, because we were told there were going to be 130 of you. So we're happy that it isn't going to be quite as unmanageable as all of that. Yes?
There's still a whole bunch upstairs.
In looking at this, we've initially yesterday over a couple of beers thought that we were somehow blessed because the problem statement that we have and which we're hoping to find solutions to over these next 2 days is quite a simple one. Ultimately, what we're talking about is at whichever level, whether it's in the communities, whether it's in the health center or the school, that the person the supplies are designed for and are intended for, when they reach behind them to take a pharmaceutical product off the shelf, that item should be there. So for us, it's really about, first of all, ensuring the availability of the product, that it has to be there at the right time. And from that, our problem is basically housed in two areas. One is using technology and some of the ideas we bring up over these 2 days to improve our efficiency, which is getting the product to the end user in the most efficient way possible. And then secondly, once we've done that, to ensure that actually it's the right product going to the right people and at the right time. So that's in terms of our effectiveness measure. So really we thought that the problem solution is quite simple. However, on second thoughts this morning, I just have a slide to show you as an illustration. It is a simple problem that we face. The trouble is there's a lot of people trying to address the same simple problem. This is a slide that's done by a fellow called Steve Kinzit for JSI. And that is his map of the health supply system in Kenya. And what's interesting about it, if you think of all the different products that people are interested in tracking, and all the different organizations supplying those products, they're all having their own requirements for reporting. So if it's for antiretrovirals, there'll be people investing money because they have a certain reporting format. If UNICEF come in for bed nets, we might have a specific reporting format, as would USAID. The problem is that all these data demands ultimately, at the end of the day, are coming down onto what's put here as district-level staff. And yesterday we had a presentation about a reality check in terms of the environment we're dealing with. And you're basically looking at a reporting requirement that's all being put onto the shoulders of these people here. And these people, who are they? Well, they're working in district medical stores, or they're working in district education departments. You can assume that if they have a computer and an Excel spreadsheet, that they're lucky. In many cases, they'll be lucky to have a typewriter. They'll be probably underpaid. Salaries will come late, if at all. It's dusty, it's hot, and sometimes there's no electricity. And yet, on their shoulders is this entire requirement. So that's hopefully what, looking at in terms of some of the applications of this technology we've been talking about, there is the reality check in that the data demands being put on these very few people are quite onerous. So just to go through a little bit with what we'll do over the next sort of 2 hours, I have a colleague here, Mahfoud Bouhembel. Nice. Mahfoud is listed here as working for WFP, which he doesn't actually do. He was seconded to WFP, to the logistics cluster in Rome for a period of 2 years. And to reward him, we brought him back to Copenhagen in the middle of winter, for which he's going to, I hope, be eternally grateful. He's just briefly going to go in a little bit more detail in terms of efficiency and effectiveness, what we're after in terms of solutions, and describe a bit our operating context. Don't let that put you off. It's quite simple. Second, we have Simon, from a researcher from MIT Logistics Center in Zaragoza. He's doing a project for us, basically trying to make sense of all this technology, particularly started off in the SMS field, but not limited to that. And he's been doing a bit of desk research on some of these applications and how they're being used, and want to determine the applicability for our operations, for supply operations in general. And so some of the end product of the breakouts will be collated by him, and we'll push forward to try and create 1 or 2 pilots later on in the year. And third, we have Jonathan Jackson from Dimagi, who will demonstrate a gizmo called an Android, which is the first time I ever heard of that. That's not in the context of Terminator movies or something like that. Just to demonstrate that UNICEF did do 1 or 2 pilots using this kind of technology. And then we'll go for refreshments, and we'll start the breakout work.